So as we were discussing the location and categories of the cell, so surface mucosal cell, I have told you about the parietal cell. Now come to the surface mucosal cells. What is the most important function of these cells is to respond. They are responsible for the absorption of the food that is or secretions that are important, giving the nutrients to the cells and for absorption, and also these surface mucosal cells secrete the mucin. So mucus that is responsible for the being the protective layer of the stomach. Now discussing the next cell, that is actually the chief cell. Chief cell are also called as zymogen cells that are abundant in bases. So I can show you in the diagram. This is the base and these are the chief cells. Okay, these are all chief cells. Okay, so now discuss what is the function of chief cells. Chief cells is a proteolytic, secrete a proteolytic enzyme that is pepsin. It doesn't secrete pepsin, it secretes a proenzyme that is pepsinogen. And pepsinogen on action of HCl, you know that H positive was secreted from the parietal cell intracellular canalicule and chloride was present. So HCl formed and HCl act on pepsinogen to convert it into pepsin. Pepsin is actually a activated enzyme and responsible for the breakdown of all the proteins. Okay, it is actually a proteolytic enzyme. It also secretes lipase enzyme, so responsible for the breakdown of lipids. Now come to the next cell, that is enteroendocrine cells. Now what are the enteroendocrine cells? You can see in this circular small cell with the round nucleus in the center is actually enteroendocrine cell. What is the function of enteroendocrine cell? Is it contains granules that are and it contains entire chromatin cells that secrete serotonin. This is the most important point, that it secretes the serotonin. Serotonin is responsible for gastric motility and gastric emptying. So if you want to increase the gastric motility or emptying, you should be able to give serotonin drugs or serotonin agonists. If you want to have, if a patient is having constipation, so you can give serotonin agonists, so increase the gastric motility and gastric emptying. So correlated with your pharmacology, correlated with your pathology, so that you have a better grip over all the concepts and you will be a good doctor. Okay, coming to the next gland is, you have discussed, I discussed you the gastric gland. Now what is the other gland? Is the cardiac gland. Cardiac gland is simple tubular gland that is located in the just in the inlet of the stomach. Now what is the structure? Is cardiac gland consists of cells same as that of mucosal neck cells of gastric glands. So what is the function of cardiac glands is also, so what it will also be the same as that of mucosal neck cells, that will be to secrete mucus and protect the layer of stomach from the acidity. So it protects it from the reflux. It also secretes lysozyme that is responsible for the breakdown of peptidoglycan or other structures of bacteria and other harmful substances. So there are no chief cells or other cells that are. Now the third one is the pyloric gland, that is simple tubular gland. It contains enteroendocrine cells. Now you all know that enteroendocrine cells are also called as G cells that secrete gastrin. What is gastrin? Is actually a hormone that stimulates the HCl production. Now it is very important factor that if there is tumor of the G cells, it will increase gastrin release, and gastrin release will cause HCl production. So in Zollinger-Ellison syndrome, you will discuss or you will read it in the pathology, Zollinger-Ellison syndrome. That is actually the tumor of the G cells. That G cells are also located in the pancreas. So mostly in the pancreas, it can also occur in the stomach, as it says location is there in the stomach as well. So in this pathology, there will be tumor of G cells and it will cause release of gastrin and will cause HCl production. So there will be GERD and other causes other substances. So these are so in this way you can correlate your pathology with the normal anatomy and histology of the body, so that you have a better grip over the overhaul your medicine. So if you like, this is all about stomach. If you like my video, please subscribe my channel and hit the bell icon, and if you have any query, please tell me in the comment section. Thank you.